గారి స్పీచ్ ఇవ్వాల్సిందిగా కోరుతున్నాను. Honorable Minister for Health, Medical and Family Welfare, Rajini Madam, Guest of Honor Naveen Kumar Garu, other special guests on the dais, my dear colleagues, my dear students, and representatives of print and electronic media. On behalf of myself, staff, and students of the Medical College, Madam, I extend a very warm welcome to all of you, Madam, especially to you and to everybody else. It's indeed a privilege for us that you have chosen this auditorium as a venue, and we are delighted and overwhelmed by the gesture. Madam, such a wonderful program starting in the campus of Guntur Medical College. We are extremely thankful to you, and on behalf of Guntur Medical College, we welcome you, Madam, and with a small bouquet, Madam. Thank you.
ఎప్పుడు పక్కన ఉన్న గెలకూడదు దిగితే నిజాలు పెట్టారు అందుకే వెళ్లకుండా అదే ఆట వెళ్తుంది ఏంటది వెళ్ళి
ఆనర్ అంటే అదిగో అలా కిరీటం పెట్టడం, పరిమళ భర్త పుష్పగుచ్చాలతోటి సత్కరించడం, ఒక షాల్ ఇవ్వడం, మనసులో ఉన్న ప్రేమను వ్యక్తం చేయడం. మనమైతే చప్పట్లు కొట్టేయచ్చు. చాలా సంతోషంగా ఇలాంటి ఎన్నో మంచి కార్యక్రమాలు మన కాలేజ్లో జరగాలి, మనలాంటి డాక్టర్స్కి ఉపయోగపడాలని కోరుకోవచ్చు, తప్పలేదు. సో దయచేసి ఈ అభినందనలో మనం కూడా పాల్పంచుకుందాం. గవర్నమెంట్ హాస్పిటల్ సూపరింటెండెంట్ మిసెస్ ప్రభావతి గారు పార్టిసిపేట్ చేస్తున్నారు.
అర్థం కాల స్పీకర్ స్పీకర్ దూరంగానే ఉందన్నా, లోగో దూరంగానే ఉంది.
And I would like to invite Dr. Melissa Nyanda, Director, Division of Global HIV and TB, CDC, India. Dr. Melissa Nyanda is a physician with specialized training in infectious diseases, internal medicine and public health. Dr. Nyanda currently serves as a Director for the Division of Global HIV and TB for the CDC India office and is based in New Delhi. Prior to joining CDC, Dr. Nyanda held the position of Associate Professor of Medicine in the Division of Infectious Diseases at Oregon Health and Science University, United States of America, where she worked as a physician for people living with HIV, as an infectious disease physician and a researcher for new diagnosis for tuberculosis. Now, request Dr. Melissa Nyanda to speak on comprehensive prevention, including PrEP in Prepare program. Welcome, ma'am.
Thank you so much. Honorable Minister of Health and Medical Family Welfare, Ms. Vidala, Rajini Garu, Mr. M.T. Krishna Babu, Special Secretary, Department of Health, Medical Family Welfare, Mr. G.S. Naveen Kumar, Special Secretary, Project Director, AP SACS, Mr. V. Vinod Kumar, Commissioner, Project Director, AP SACS Health Strengthening, Dr. Shobani Rajan, Chief Medical Officer, DDG NACO, Mr. David Bridger, UNAIDS, Dr. Joseph Williams, VHS, friends and colleagues. On behalf of the United States Centers for Disease Control and Prevention and our PEPFAR team, I'm delighted and honored to be here today on the occasion of the Prepare initiative here in Andhra Pradesh. Comprehensive and combination prevention tailored to reach populations at high risk for HIV is critical to bending the curve toward fewer and fewer new infections as we surge towards the last mile to end HIV as a public health threat by 2030. I congratulate NACO, ASDG SIR, and the NACO team on the release of the PrEP guidelines as a roadmap to inform providers and community on PrEP as an additional prevention choice, adding to the combination prevention basket, which includes condoms, harm reduction, post-exposure prophylaxis, regular testing for STIs, risk reduction counseling, regular testing for HIV, and also HIV treatment. I congratulate the government of Andhra Pradesh, AP SACS, for kicking off this incredible initiative, the Prepare initiative, to increase awareness on PrEP and to reach out to those at substantial risk for HIV. For a person who is at high risk for HIV and who is confirmed to be HIV negative, there is considerable evidence base that establishes that oral pre-exposure prophylaxis, or PrEP, substantially reduces the risk of HIV infection. I've been working here in India now for over 4.5 years, and Andhra Pradesh is known as a hub of innovation in the delivery of HIV prevention and treatment services. I'm always impressed with what comes out of Andhra Pradesh, and CDC, through our partner VHS, is privileged to work hand in hand with APSACs, providers and community on expanding PrEP access as a robust part of combination prevention, with, importantly, a person-centered approach. Globally, PEPFAR programs have brought together learnings from what we call differentiated service delivery platforms, which essentially is person-centered care, to expand options for PrEP. And these innovations, as in the case of HIV treatment, were leveraged during COVID. We have to remember how much we learned about health delivery during COVID times. Considerations and innovations in PrEP access, partnerships with communities, and working with community-based preferred providers, options like teleprep and other community-based options are all needed to be adapted for community needs. On behalf of CDC, we're so excited to see the innovation and impact on the community strategies here in Andhra. In closing, for people at substantial risk for HIV, we know that PrEP is a medicine that, when taken as prescribed and used consistently and correctly, significantly reduces the risk of getting HIV. And it is a robust addition to combination prevention basket. It's important to continue to increase awareness on PrEP and innovate around increasing access among people with substantial risk for HIV, while also expanding access to all the forms of combination prevention. In doing so, together we will continue in our joint effort across the prevention to treatment continuum to end HIV as a public health threat by 2030. On behalf of CDC, thank you so much for the opportunity to be here. Thank you, Madam.
Thank you so much, Melissa ma'am, for your vision and hard-working nature. And thank you so much. Now, Mr. David Bridger, Mr. David Bridger brings over 30 years of experience in health and HIV. Throughout his career, Mr. Bridger has built substantial experiences across policy and programming development, along with broad contributions to advancing the organization's technical work. His skills to benefit government and civil society's contributions to bilateral and bilateral spheres, and brought his practical expertise in leadership to support UN reform at country level. Due to some unavoidable situation, Mr. David Bridger could not come here in person. However, he has sent a pre-recorded version and it will be telecast now. He has shared the global experiences in scaling up PrEP lessons and recommendations. Let's listen to him.
Principal Secretary and Special Secretary of the Department of Health, Medical and Welfare. Leadership and staff of the Andhra Pradesh State AIDS Control Society, fellow special guests of the podium. My sincere apologies that I could not be with you today in person. As this is such an important initiative, I prepared a few words of support and will speak to the global experience in scaling up PrEP, lessons and recommendations. A decade has passed since the World Health Organization first recommended the use of oral PrEP as a prevention option for people who are at high risk of HIV infection. PrEP is recognized as a key prevention strategy and included in the UNAIDS Global Prevention Roadmap as a prevention pillar and within the global prevention targets for 2025. In 2021, it's estimated that 1.6 to 1.8 million people worldwide in at least 86 countries were receiving oral pre-exposure prophylaxis, or PrEP. This is nearly double on the numbers for the previous year and is driven by a scale-up in Eastern and Southern Africa, largely in the countries of Kenya, South Africa and Zambia. In Asia Pacific, in this region, in 2021, more countries than ever before had a PrEP program, but they still remain at insufficient scale, with total number of people on PrEP less than 2% of the Asia Pacific target for 2025. We have evidence that PrEP at scale can have a substantial population impact on HIV diagnosis. PrEP programs over the past 4 to 5 years in places such as the United Kingdom saw HIV diagnosis decline by 35%. And in the United States, in the city of San Francisco, HIV diagnosis declined by an enormous 58%. And in my country, my home country of Australia, in the state of New South Wales, HIV diagnosis declined by over 25%. And as a result, in 2018, PrEP has been listed as a preventative medication and is available through Australia's Universal Health Program. So, what is the success? What is the recipe for success of PrEP? And we've had a rich body of experience to draw on and strong emerging examples in this region from countries such as Cambodia, Thailand and Vietnam. PrEP works where we see engagement of multiple stakeholders, where we see government leadership, which is critical, and where we see community involvement, which is essential. And programs must be client and community centred. So, just briefly, let me outline 3 key recommendations in terms of implementing and moving forward with PrEP. Firstly, the need to ensure that health systems and settings are PrEP friendly. That means that medical providers need to know about PrEP, be willing to prescribe it, and understand how to manage its ongoing use. Services especially need not to stigmatise current or potential PrEP users and those at risk of HIV infection. Secondly, there's a need to ensure that there's a strong partnership with community. PrEP programs should be nested within the broader HIV prevention and health promotion efforts, which include HIV testing, treatment, sexual and reproductive health services, and potential health and substance use services as well. And thirdly, there's a need to address the individual level barriers to PrEP. And we need to address this through promoting awareness of PrEP, examining the willingness to use, and supporting people to understand their risk. Colleagues and friends, PrEP scale-up must accelerate if we are to meet those UNAIDS prevention targets for 2030. We must collectively call attention to the fact that we have an almost 100% effective tool to prevent HIV. This is a major HIV prevention milestone. I'm confident that introducing PrEP through this program in Andhra Pradesh is an important step forward and the start of a new era of HIV prevention in India. Thanks, everyone.
Thank you so much, Rajini sir, for being with us on virtual mode. Thank you so much. And I take my privilege to introduce Dr. N. Kumaraswamy is the Chief and Director of Infectious Diseases Medical Center at VHS Hospital in Chennai. He is a clinician and a researcher in infectious diseases with more than 25 years of experience. He has a particular interest on the long-term impact of antiretroviral therapy in resource-limited settings. Now, it's time to invite Sir, and we now request Dr. Kumaraswamy sir to speak on operational lessons and PrEP initiation and adherence in line with national guidelines. Welcome, sir.
Thank you. Good evening, everyone. At this time, respected Honorable Minister, Madam Rajini, thanks for this kind invitation to your state. Respected friend now, Mr. Naveen, CDC Director, you heard from her in the, just before this program, Melissa, and also my close doctor fraternity from Guntur Medical School. Thank you so much for having me in this beautiful auditorium. And my own colleagues from BHS, colleagues from CDC, and NACO, and press, and everyone. I've been asked to talk to you very briefly in 3 minutes about the operational issues in implementing this PrEP program. It's very important. We can always talk about programs and implementation. If it's not going to run smoothly, it's going to cause a problem. I'm going to take a minute to talk about this PrEP sign, which you heard from our area speakers. If it is being taken correctly as prescribed, the chance of preventing HIV is almost 99% based on science. Following this, in the year 2017, in Chennai, we did a PrEP consultation in collaboration with NACO, Indian Council of Medical Research, National Institute of Epidemiology in Chennai, trying to understand how we are going to implement PrEP in India. That is 5 years back. At that time, we came up with a lot of operational issues. Who is going to prescribe PrEP in India? Because we have a lyric system, only a doctors can prescribe. And these medications are not like chocolates, which also have a lot of side effects, so it has to be closely monitored. And also you need to do a lot of adherence counseling. You heard from Melissa, CDC Director. If it is not taken as prescribed, it's not going to work. So following all this, we initiated this implementation program in Chennai at our clinic in Chennai. We prescribed this for nearly 1,000 people who need PrEP, which including serodiscordant couple, one partner positive, another negative, especially for them to have a physical baby, which can be HIV negative. So we learned so much lesson from this, as well as from other programs which have been implemented in Thailand and Africa and in other countries. So what we learned is, if you don't do a proper treatment literacy to the PrEP users. Here they are not patients, they are negative people who got a high risk on them. When to take it, how to take it, as well as the importance of adherence. And also, if you don't implement testing on them, we also heard from Melissa, it is only for people who know that they are negative. So before they take it, you do a testing on them. So operationally, the place should also have a friendly, user-friendly testing environment. And also, as I said, it is not like a chocolate. You have to closely monitor. They have to take it. You need to have a supportive staff and also close monitoring for the side effects of these drugs. And all should be done in the package. That's all we learn by implementing this, not only in India, but also in other countries. We put all this for a program here for Andhra Pradesh through our what is called one-stop center, which I'm going to talk to you soon. And again, you all know that when someone patients, they can come to a clinic, but normal people don't like to come to a hospital. Here, the PrEP users are normal people, but they have high risk. They wanted to take these medicines. So if you do all this inside a hospital, they're not going to come to you. So you have to take them to their doorstep or to the community setting. So here, to make it operationalized, we have done this in the community setting as a one-stop center, which is also closely linked to our government ART center, and also run by our community members who are all trained in what is PrEP and how they can do monitoring of their own community members to implement this. With all this now, ma'am, now we have been implementing around anything from 13 to 20 one-stop centers here, and with this, we estimate more than 50,000 people might receive this PrEP. I think with this model, probably Andhra Pradesh will be one of those first, not only in India. I have not seen 50,000 people in any part of the world from one single province or state. Probably this could be a model state where everyone can learn from you all, and from this, it can be easily scalable, the model which we are developing to other states as well as other parts of the world. So again, thank you again for this opportunity to work with you all, and we look forward for this continued collaboration. Thank you so much.
Thank you very much for your passion and emotion, sir. Actually, we understand your efforts towards this field. And thank you so much. Now, ఎప్పుడైనా ఒక వ్యాధి ఎవరికైనా వచ్చింది అంటే వెంటనే వాళ్ళని ఒకలాగా చూస్తాం. ఆ వ్యాధికి మందులు ఉన్నాయో లేదా అని వెతుకుతాం. అది మనకు అంటుకుంటుందేమో అని భయపడతాం. కానీ మనకే ఆ వ్యాధి వచ్చినప్పుడు ఆ దృక్పథం మొత్తం చేంజ్ అయిపోతుంది. దాన్ని ఎలా ఎదుర్కోవాలి, దానికి ఎలాంటి మెడిసిన్స్ కావాలని పోరాటం చేస్తాం. ఈ సమాజంలో దాన్ని ఉన్నా కూడా ఎలా ఎదుర్కొని బతకాలి అనే దానికి కృషి చేస్తూ ఉంటాం. మరి అలాంటి ఎన్నో విషయాల పట్ల వాళ్ళు మాట్లాడటానికి, అలాంటి వాళ్ళతో చూసిన ఎక్స్పీరియన్సెస్ కానీ, వారికి ఆ కమ్యూనిటీలో ఉన్నటువంటి పరిచయాలతో కానీ మనతో ముచ్చటించడానికి ఒక ముగ్గురిని ఎంపిక చేయడం జరిగింది. శ్రీమతి మల్లేశ్వరిని రావాల్సిందిగా ఆహ్వానం తెలియజేస్తున్నాను. తను మనతో కొన్ని విషయాలు పంచుకుంటారు. వారికి స్వాగతం.
ముందుగా వేదికను అలంకరించిన హెల్త్ మినిస్టర్ గారికి మరియు పెద్దలందరికీ నా హృదయపూర్వక నమస్కారాలు. నా పేరు మల్లేశ్వరి. నేను గత 2 సంవత్సరాల నుండి సెక్స్ వర్క్లో ఉన్నాను. నా దగ్గర రకరకాల క్లయింట్స్ వస్తూ ఉంటారు. నేను హెచ్ఐవి నివారణ కార్యక్రమాలు ఉపయోగించుకుంటూ ఉంటాను. కానీ కొన్ని సందర్భాల్లో క్లయింట్ కండం యూజ్ చేసే ఇది కూడా మా చేతిలో ఉండదన్నమాట. ఒక్కొక్కసారి ఒక క్లయింట్ అని చెప్పి 3 ఇద్దరు వస్తూ ఉంటారు. అప్పుడు మాకు హెచ్ఐవి వస్తుందేమోనని మేము భయపడుతూ ఉంటాము. కానీ నేను ప్రప్పు మందు గురించి విన్నాను. విహెచ్ఎస్ ప్రాజెక్టు ఎక్స్పైరీ వారు ఏర్పాటు చేసిన ప్రప్ ట్రైనింగ్కి అటెండ్ అయ్యాను. అక్కడ డాక్టర్ గారు చెప్పిన విధంగా ప్రప్పు మందు వాడుతుంటే మాకు హెచ్ఐవి రాదని గ్రహించాను. ఇంకొక విషయం ఏంటంటే విహెచ్ఎస్ ప్రాజెక్ట్ ఎక్స్పైరీ వారు వన్ స్టాప్ స్టాండర్డ్లో ప్రప్పు గురించి చాలా బాగా చెప్పారు. ప్రప్పు తక్కువ ధరలో కూడా దొరుకుతుందని చెప్పారు. నేను ఆ వన్ స్టాప్ సెంటర్కి వెళ్ళాను. అక్కడ డాక్టర్ గారు ప్రప్పు గురించి చెప్పారు. నేను అప్పటి నుంచి ప్రప్పు వాడుకుంటున్నాను. నేను చాలా హ్యాపీగా ఉన్నాను. ప్లస్ నాకు టెన్షన్ లేదనమాట. నన్ను నేను కాపాడుకుంటూ నా దగ్గరికి వచ్చే క్లయింట్స్ని కూడా కాపాడగలుగుతాను. అంతేకాకుండా నా కుటుంబంతో నేను సంతోషంగా జీవిస్తున్నాను. నాకు ఒక పాప ఉంది. మా పాపకి మంచి భవిష్యత్తు ఇవ్వగలుగుతానని ప్రప్పు మందు నాకు నమ్మకం కలగజేసింది. నిజంగా మాలాంటి జీవితాలకి ప్రప్పు మందు ఒక వరం. నాకే కాదు, మా కమ్యూనిటీ కూడా. ఈరోజు ఈ కార్యక్రమం మేడం గారి చేతుల మీదుగా జరుగుతున్నందుకు నాకు చాలా సంతోషంగా ఉంది. ఈ అవకాశం ఇచ్చిన హెల్త్ మినిస్టర్ గారికి మరియు ఏపీ స్టాఫ్ పీడీ గారికి మరియు బృందానికి నా కృతజ్ఞతలు. ఈ సందర్భంగా హెల్త్ మినిస్టర్ గారిని మరియు విహెచ్ఎస్ ప్రాజెక్ట్ ఎక్స్పైరీ వారికి మా కమ్యూనిటీ తరఫున ఒక విజ్ఞప్తి. ఇలాంటి అవగాహన ప్రోగ్రామ్స్ ఇంకా చేపట్టాలని వేదిక మీద ఉన్న పెద్దలందరినీ కోరుకుంటున్నాను. ఈ అవకాశం ఇచ్చినందుకు మీ అందరికీ ధన్యవాదాలు.
థ్యాంక్ యూ మల్లేశ్వరి గారు. మరి కష్టాలు అనేవి వస్తూనే ఉన్నాయి. వాటిని గురించి మనతో ముచ్చటించే ధైర్యం, మనతో మాట్లాడాలి, పంచుకోవాలి, చెప్పడం ద్వారా మనందరినీ ఎడ్యుకేట్ చేసినందుకు తనకి కృతజ్ఞతలు తెలియజేసుకుంటూ ఉన్నాను. ఇప్పుడు మిస్ శోభిని రాజన్ వారు మనతో కలవలేకపోతున్నారు. బట్ వర్చువల్లీ మనతో వారు మాట్లాడతారు. ఐఎమ్ వెరీ గ్లాడ్ టు ఇంట్రడ్యూస్ Dr. Shobhini Rajan, Chief Medical Officer, SAG, National AIDS Control Organization, Ministry of Health and Family Welfare, Government of India. Dr. Rajan is a pathologist and senior public health expert with expertise in laboratories, sexually transmitted infections, blood transfusion services, strategic information, community engagement, etc. with approximate 2 decades of experience in the government healthcare sector under the Central Health Services, Ministry of Health and Family Welfare, Government of India. She is an alumni of University of Delhi, graduated from Lady Hardinge Medical College and possesses post-graduation in pathology from Maulana Azad Medical College. Currently, she is associated with National AIDS Control Organization under the Ministry of Health and Welfare and Chief Medical Officer Senior Administrative Grade, and leads the Targeted Intervention Division, Basic Service Division and Sexually Transmitted Reproductive Tract Infections Division. Due to some unavoidable situations, Dr. Shobhini Madam could not attend in person. However, she is here with us virtually and she will now speak on the national perspectives of integrating PrEP in the prevention program. Let's hear from her. Welcome.
Honorable Minister, Health, Medical and Family Welfare Wish, other esteemed dignitaries on dais, friends and colleagues, good evening to everyone. I thank Andhra Pradesh State AIDS Control Society and CDC PEPFAR for organizing this important event of inaugurating the Prepare Andhra initiative. As a result of comprehensive and sustained interventions through various phases of the National AIDS and STD Control Program of the government, HIV/AIDS disease has an overall declining trend in India. As per the HIV estimates of 2021, annual new infections have reduced by 80% since the peak in 1996. While AIDS-related deaths have declined by 85% since the peak in 2005. Globally, annual new infections have declined by 54% and AIDS-related deaths have declined by 68% and 22 fraction. The Government of India is implementing its fifth phase of the National AIDS Control Program, which is a central sector scheme fully funded by Government of India to prevent the spread of HIV infections, keeping more than 99.5% of the adult population HIV free. This scheme is being implemented with effect from 1st of April 2021 to 31st of March 2026 with an outlay of 15,471 crores. Under the program, more than 4 crore HIV tests are being done annually at over 35,000 facilities, and around 14.8 lakh people with HIV are taking free, life-saving, high-quality antiretroviral medicines from 681 antiretroviral treatment centers. Alongside, more than 9 lakh viral load tests are being done among PL-HIVs who are on treatment to monitor the effectiveness of treatment towards attainment of viral load suppression. Some of the key priorities for prevention under NACP Phase 5 are HIV/AIDS Prevention and Control Act 2017, revamped strategies for targeted interventions, interventions in virtual platforms, community system strengthening, elimination of vertical transmission of HIV and syphilis, etc. And NACO always works collaboratively with all stakeholders and partners, as it allows us to look at innovations that are cost-effective, sustainable and replicable. With respect to pre-exposure prophylaxis, the National AIDS Control Program has released on World AIDS Day last year the National Medical Guidelines on Pre-Exposure Prophylaxis, which talks of who should be given PrEP, how should risk assessment be done, what are the entry and exit points for PrEP, what are the procedures one should follow, especially the clinician, since the drugs that are in question there are Schedule H drugs. These guidelines also talk of modalities that can be considered for PrEP implementation. So we understand that under Project Aspire, one of these models is being implemented through private providers and virtual approach. And from NACO, I would like to reiterate that we are very confident that the modality that Project Aspire is going to take forward is totally aligned to the national guidelines. NACO will be closely monitoring this activity, since the evidence being generated will help us to plan the implementation and scale up the PrEP through Sampurna Suraksha Kend or the virtual interventions that are there as part of the program. I would like to also draw attention that since this event is awareness, prepare has an A, talking of awareness. It's critical that we consider PrEP as one of the kegs in the combination prevention approach. So it is one of the options in the basket of prevention choices. So while we talk of PrEP, we do not forget to talk about condom promotion and also about risks of getting other sexually transmitted infections. And therefore the communication materials and the messaging around PrEP should be comprehensive and should look after this aspect. I'd also like to say that while we talk of PrEP, we also need to talk about post-exposure prophylaxis for sexual exposure, which is done by the means of the same drugs. The only difference being that the client will reach us after he has had a sexual exposure. So lastly, I would once again like to congratulate Andhra Pradesh government, Andhra Pradesh State AIDS Control Society, the project director in particular, and CDC for organizing this meeting, and we look forward to evidence that comes from this meeting, which can be adapted to national context. Thank you very much.
థ్యాంక్ యూ సో మచ్ మ్యామ్. ఇక మరి స్టూడెంట్స్ అంతా కూడా ఎదురు చూస్తూ ఉన్నారు. చాలా త్వరలోనే ఈ కార్యక్రమం మనం ముగించుకుందాము అంత ఇంపార్టెంట్ విషయాలు విన్న తర్వాత. అలాగే మరి కమ్యూనిటీ నుంచి ఒకరి ఎక్స్పీరియన్స్ వినడానికి మనం సిద్ధంగా ఉన్నాం కదా. మిస్ అమృత తన ఎక్స్పీరియన్స్ చెప్తుంది.
ముందుగా గౌరవనీయులైన ఆరోగ్య శాఖ మంత్రి గారికి, వేదిక మీద ఉన్న అతిథులందరికీ నా హృదయపూర్వక నమస్కారాలు చేసుకుంటున్నాను. నా పేరు అమృత. నేను విజయవాడ నుంచి వచ్చాను. నేను ఒక ట్రాన్స్జెండర్ని. నేను 10వ తరగతి చదువుతున్నప్పుడు నా స్థితిని నేను కనుగొన్నాను. ఆ సమయంలో నా ఫ్రెండ్ నాకు ట్రాన్స్జెండర్ కమ్యూనిటీ దగ్గరికి నన్ను తీసుకువెళ్ళి వాళ్ళలో చేర్చాడు. నేను 1.5 years ఆ ట్రాన్స్జెండర్ కమ్యూనిటీలో వర్క్ చేసి ఆ తర్వాత నా తల్లిదండ్రుల కోసం నేను తిరిగి వెనక్కి వచ్చాను. ఆ సమయంలో నా తల్లిదండ్రులు నన్ను రిజెక్ట్ చేశారు. అప్పుడు నేను ఒంటరిగా జీవించడం మొదలుపెట్టాను. నా ఒంటరి జీవితానికి జీవనోపాధి కోసం నేను ఒక చిన్న ఫ్రూట్ జ్యూస్ షాప్లో వర్క్ చేస్తూ నైట్ టైం సెక్స్ వర్క్కి వెళ్ళేదాన్ని. సెక్స్ వర్క్కి వెళ్ళిన ప్రతిసారి కస్టమర్తో కాండం ఉపయోగించడం వీలయ్యేది కాదు. ఎందుకంటే కస్టమర్ కాండం లేకుండా సెక్స్ చేయి, నీకు ఎక్కువ డబ్బులు ఇస్తాను అనగానే నా ఒంటరి జీవితానికి జీవనోపాధికి ఆసరాగా ఉంటుందని నేను ఆ డబ్బుల కోసం కాండం లేకుండా సెక్స్లో పాల్గొనేదాన్ని. కానీ నాకు హెచ్ఐవి వస్తుందని ఒక భయం నాలో కలిగింది. అలాంటి సమయంలో విహెచ్ఎస్ సిడిసి యాస్పర్ ప్రాజెక్ట్ ట్రైనింగ్కి నేను అటెండ్ అయ్యాను. అక్కడ నాకు హెచ్ఐవి ప్రివెన్షన్ గురించి మరియు ప్రెప్ గురించి విన్నాను. ప్రెప్ గురించి విన్న తర్వాత డాక్టర్ మేడం నేను కలిసి మరింత సమాచారం తెలుసుకొని ప్రెప్ మెడిసిన్ వాడదామని మేడంతో చెప్పగా, ఈ ప్రెప్ మెడిసిన్ వాడడం ద్వారా హెచ్ఐవి వచ్చే అవకాశం చాలా తక్కువగా ఉంది అనగానే నేను మేడంతో ప్రెప్ మెడిసిన్ నేను వాడతాను మేడం అనగానే మేడం టీజీ వన్ స్టాప్ సెంటర్ దగ్గరికి నన్ను తీసుకువెళ్ళి అన్ని విధాల టెస్టులు చేయించి ఈ ప్రెప్ మెడిసిన్ నాకు ఈ ప్రెప్ మెడిసిన్ వాడించింది. ఈ ప్రెప్ మెడిసిన్ వాడటం వల్ల నాకు ఒక మానసిక ఒత్తిడి తగ్గింది. ఎందుకంటే నేను ధైర్యంగా ఇప్పుడు సెక్స్ వర్క్కి వెళ్తున్నాను. ఎందుకంటే ఇప్పుడు ప్రెప్ శక్తి నా చేతుల్లో ఉంది. మరియు ఈ ప్రెప్ అనేది నాకే కాదు, నాలాంటి వాళ్ళందరికీ చాలా ఉపయోగకరంగా ఉంది. మరియు ఈ అవకాశం ఇచ్చిన గౌరవనీయులైన ఆరోగ్య శాఖ మంత్రి వారి గారికి మరియు ఏపీ శాక్స్ పీడీ గారికి, వేదిక మీద ఉన్న అతిథులందరికీ నా హృదయపూర్వక ధన్యవాదాలు తెలియజేసుకుంటూ సెలవు తీసుకుంటున్నాను.
Respected dignitaries and everyone here. My name is Vishnu Teja. I'm a gay man from Visakhapatnam and I'm working for last 10 years for the upliftment of sexual minorities. And I'm very happy and glad today because I started using this PrEP since last 5 years when I was in London. But there it's very difficult after 2 years coming back to India. Then I started my prescription from Delhi and receiving this PrEP from Bombay. And it is very difficult for me to purchase 750 rupees each bottle. And today I'm very happy that our home state Andhra Pradesh, with the help of the Ministry of Health and EPISACs and VHS, I'm receiving it just 450 rupees each bottle. And I hope This will definitely help the stigma and discrimination which is associated with the sexual minorities in terms of this HIV prevention. And thank you so much for this wonderful opportunity. Thank you everyone.
Thank you so much, Vishnu. And this is my privilege to invite Saint G.S. Naveen Kumar, IAS, Special Secretary to Government, Health, Medical and Family Welfare Department, and Project Director, Andhra Pradesh State AIDS Control Society. He is a celebrated administrator having varied experience in government service at the decision-making level. As a Special Secretary and Project Director, AP SACS, he is overseeing the programming aspects on STI, HIV, AIDS, prevention, care and treatment continuum interventions with guidance and support from the Government of India. Importantly, efforts are invested in building systems and enhancing the community empowerment among high-risk groups and PL-HIVs for sustaining the response in HIV 95 targets. We now request our sir to speak a few words about this.
I should probably thank Madam in the beginning for one reason. Whenever we go to her with some idea, she never says no. She says, how do we do it today? So that's the question she'll ask. So this has been the approach of AP government for the last 1 year. I've been in this department for some time, and when you ask any idea with respect to health, the first question they'll ask, how do we do it? So I think that's the reason AP has always been the leader in healthcare, and it's been the leader for a long time in AIDS and HIV control. And with your leadership, ma'am, I think we'll continue to be the leaders in HIV and AIDS control, and we'll again prove we are the best state in the country. And I should also thank VHS team, Melissa, for bringing this opportunity. I think there are a lot of things which happen in the field, which we would not know. For example, I think probably when the principal Guntur Medical College was talking about PrEP, the same experience I also found when I asked some people who are doctors in my own family, when I asked them what is PrEP, they have studied about PrEP. They might be knowing maybe as a glossary, maybe as an abbreviation. They would not know what exactly it goes, how it goes. Probably this is one of the opportunities we thought. When we asked Minister Madam Bench, where should we have this event, she suggested she should have it in the Guntur Medical College. I didn't understand why she asked me to do it in Guntur Medical College. Now I understand clearly, it's not just about putting the program or inaugurating the program. It's also important every single student who is sitting here, the MBBS student, the pharma student, the nursing student, would be the messengers for this public health practice which we are start launching today. So that's very important. I think I should thank Madam for it. In fact, I should also thank two of my, I quoted in my opening speech, 2 Ps. In fact, Prepare itself has this 2. One is Prabhavati Madam and the other one is Padmavati Madam, who had helped us to launch this program. I think probably when I came for a small inspection 2 weeks back, I came to see this beautiful hall. I was actually surprised that we have a very good hall, and I think we'll also host many of the upcoming programs in this hall. So I thank both of you for making this event happen. What is PrEP? PrEP is not an alternate strategy. That's very important. We always think, I think when they spoke, 1 or 2 or 3 of our people spoke, it's not an alternate strategy. It is one of the strategies within the prevention strategy. That's very important. I think that's the missing gap. What we are doing is the missing gap. When we have a lot of prevention strategies, we have a missing gap. There is I think Melissa, when I spoke to her in Delhi, she talked about the negotiating power, when the people do not have a negotiating power. So what do they do when they don't have a negotiating power? They do have an option now. Earlier they did not have an option. The option is called PrEP. And I think this is the bigger message which we are launching today. We are giving that woman, that lady who doesn't have that negotiating power, an opportunity to protect herself. That's the most important message which this program is doing today. So that's the most important thing we are looking at. The AP SACS is also looking at 95. I think the concluding remarks of the compare was that 95. What is 95? The first 95 is know your status. That's the most important part of the 6A, of healthcare. The awareness and acceptability. The moment you do, this 2 part depends on the patient or the client, which we call. So the moment they accept they have an issue, that's where your treatment starts. Your basic treatment starts when you talk about your healthcare, when you accept that fact that you are in need for a treatment. So that's where your treatment starts. The other three, which I think Dr. Kumarasamy spoke, was accessibility, availability, affordability. That's the government part. We are going to provide it. That's one of the reasons we are giving this solution also, this particular PrEP solution also for you. So, and all our one-stop solution, stop centers which they are putting up, the VHS is putting up, will also be a NCD screening center. And that's what we are looking at. It's not just about talking about one part of our solution. We are talking about comprehensive primary care. It's not just one particular part of our solution. So we are going to talk about comprehensive primary care. And what is the second 95? The adherence. I think Melissa spoke about adherence. That's the key for everything. The key for your well-being is the adherence. Be it supplements, taking food on time, taking sleep, having your proper sleep. These are the most important factors for your own well-being. It's not just about taking medicines on right time, right? So you're talking about the adherence. It's just keeping your body and mind and your well-being. That's the most important part. And also the medicines. You stick to your medicine. Most of your care in the future would be continuous care. You are not talking about adult care or you had an accident, you had an injury you created. We are talking about a new disease pattern which is growing up, which needs the continuous care. So which means that you need to adhere to a longer times. The lessons we learned from HIV and AIDS control is going to help us in controlling our NCD care in the future. So that's the future of our healthcare. The last 95 years, we are going to test. We are also tied up with some courier agencies to use our viral load labs. Today we had a discussion with the CV NOT machines and the 2 NOT machines which we have bought. We'll try to realign. That's the government part which we'll do. We'll keep you tested, we'll see whether your viral load is under control or you need alternative drug medicine. So we are there, the experts are there, like Dr. Kumarasamy, who's a leading authority in HIV/AIDS control from our country. And we also have CDC to support us. So this is what we are looking at. I heartily thank Madam for giving this opportunity to AP SACS for launching this program and also leading this campaign. Once it starts in Andhra, it rolls out in the entire country. With these words, I conclude my remarks.
Thank you very much, sir. Now it's time, and we request the Honorable Minister to unveil the program on PrEP awareness and reach out in Andhra Pradesh by pressing the remote. Please, ma'am. With your golden hands, just inaugurate that. Let us join hands together to make it a grand success. There is no sound at all in between your hands. Please make it a round of applause. It's a wonderful moment that you will do. Thank you, ma'am, for inaugurating the program Prepare Andhra initiative. And now it's time. VHS Project Aspire has prepared a jingle on PrEP, and we request the minister to release the jingle by pressing the remote. Now the photo session is going on with that. Now it's time to release the jingle by pressing the remote by our Honorable, beloved Health Minister, Ms. Vidala Rajini garu.
Let's
Thank you so much, ma'am. Now it's time. We request our Honorable Minister to release the posters developed for PrEP. Srimati Vidudala Rajini garu, Honorable Minister, Health and Medical and Family Welfare. On her hands.
పైకి పోయి వాళ్ళు చెప్పుంటే మేము కూడా పైకి వచ్చేవాళ్ళంగా తిన్న కుదిరేది
The posters, which are very helpful in the society, they may convey the information regarding PrEP.
సార్
Let us join together to make it a grand success. Thank you very much, ma'am, for the initiation of this.
కొంచెం దిగితే మేము సైడ్ ఫ్రేమ్ తీసుకుంటాం.
Now one more item is there, that is
అక్కడ నుంచి
asking questions and replies. We request the
ఏమని పొట్ట వస్తుంది
request of our beloved minister to
చెప్తాను
release the PrEP FAQ booklet and hand over the special secretary and project director AP Sachs.
పెట్టరా మరి బ్యాటరీ చూపిస్తే
Our beloved Honorable Minister of Health, Medical and Family Welfare, Ms. Vidudala Rajini garu, on her golden hands, she is going to release the booklet, FAQ booklet.
మనుషులు కొంచెం ఉండాలి.
Thank you so much, ma'am. It's really a great honor that these books are released by your golden hands and by the dignitaries. And now, Honorable Minister for Health and Family Welfare, Ms. Vidudala Rajini, is an Indian politician. She is the Minister for Health, Family Welfare and Medical Education in the Government of Andhra Pradesh. She is a member of Legislative Assembly, Chittoor Assembly Constituency of Andhra Pradesh. Her intention is to improve the government hospitals by providing the best infrastructure, modernized machineries, and to provide better health care to the poor and needy. Her intention is to develop Andhra Pradesh as an icon of Arogya Andhra Pradesh. She is very much committed to bring healthcare services within the reach of the poor and commoner. Free and quality services will be provided to the people of Andhra Pradesh. 16 medical colleges will be coming up in the state as per the plan, and it is to set up a medical college in each parliamentary constituency. Strengthening the YSR Arogyasri, the brainchild of former Chief Minister of Undivided Andhra Pradesh, Shri Y.S. Rajshekar Reddy. Awareness on cancer would be created in a massive way and medical facilities would be provided to the needy. The recent news explicitly tells us how she is kind enough to a 9-year-old kid, Ashok, has lost his father and living with a sick mother. He himself was a victim of cancer at the early age. Our Honorable Minister has taken an initiation by meeting him personally and assured him and she would grant 50 lakh rupees. Already she has granted that from the government for his treatment expenses. Let's welcome her, the grand lady. Now we request our Honorable Minister to unveil the program and she is going to give us a keynote address on this program. Welcome, ma'am.
Virtually, CM Monaco, who has joined the meeting, Sri Naveen Kumar, Special Secretary, Dr. Melissa Nindak, Director, CDC, DGST, and Dr. Joseph Williams, Director, Projects, Voluntary Health Services, Dean of Guntur Medical College, officials from AB Sachs, partners, media, students, and importantly, the communities who are the central to our programs. A very warm welcome to each and everybody. Let me first acknowledge the excellent work carried out by Andhra Pradesh State AIDS Control Society in scaling up the HIV response along the prevention to take care in treatment continuum. And happy to mention that we are closing the gaps in reaching epidemic control in Andhra Pradesh. As of July 2022, we have diagnosed 2,65,256 out of the estimated 3,13,725 PL HIVs in the state, and we have 48,469 remaining that needs to be diagnosed. Out of the 256 positive cases detected, we have put 2,02,812 on treatment, and we have 62,444 remaining that needs to be put up on the treatment. We need to work even hard and do more as we are entering the last mile to reach the remaining targets and achieve epidemic control. I'm also proud to say that Andhra Pradesh has piloted several innovative programs to enhance the HIV response. We have implemented index testing at scale, and this helped us fast-track HIV case finding and fidelity. NACO is keen to replicate the index testing program at national level and will do so soon. To improve access to the treatment, Andhra Pradesh led the way by demonstrating differentiated models of care such as multi-month ART drug dispensation, and this has been adapted by the national program. I would like to thank NACO for their support given to the state, and we implement programs in accordance with the national guidance. Besides, there is close collaboration between National AIDS Control Program and National Viral Hepatitis Control Program. When this invitation was extended for me inaugurating a vital prevention initiative of promoting PrEP, I really accepted. I accepted because it is a very important initiative of reaching out and providing prevention services to the people of Andhra Pradesh. I would like to express here that there is an urgency for us to prevent HIV among the key populations. The health of vulnerable key populations is equally important. I would like to say here that our dynamic Chief Minister, Sri Y.S. Jagannath Reddy Garu, will ensure equitable access to prevention programs to the vulnerable key populations and will leave no one behind in the response. Here, I would like to laud the efforts of voluntary health services who, with support from CDC, have done stellar work in bolstering the prevention efforts, especially among the vulnerable key populations. Their efforts on mainstreaming transgender healthcare in the government health system by establishing one-stop centers at the Government General Hospital is highly appreciable. This is the first time in the country that an initiative at this scale of providing comprehensive care for transgender and other key populations in the government hospitals has been carried out in Andhra Pradesh. I would also like to take a moment to thank CDC, Dr. Melissa and her team for their support to the state in scaling up the HIV response. As a health minister, the vulnerable communities are my biggest priority, not only in HIV but all in health programs. Providing access to quality health care to all and particularly the poorest of the poor families is what we strive for, and we are making great progress in the state by achieving universal health coverage. Our Honorable Chief Minister, Sri Y.S. Jagannath Reddy Garu, gives highest priority for the attainment of all the sustainable development goals. To achieve the sustainability development goals, our Honorable Chief Minister has taken governance to the doorstep of people, ensuring all the welfare schemes and health services reaches the most marginalized people, including the poor and the key population communities. In line with the vision of our Honorable Chief Minister, the ward and village secretary jobs for welfare development and health activities will ensure that the Gram Sachivalayam also reaches out to the vulnerable key population communities and provide not only HIV and health but also development services, as we want to improve the quality of life of these populations we are talking about. I would like to affirm that prevention will remain the mainstay, and it is fundamental to all our efforts in achieving epidemic control. The invention of pre-exposure prophylaxis as a biomedical tool is cornerstone of HIV prevention and in halting new HIV infections. Experts have firmly established that PrEP is extremely effective in reducing HIV acquisition, resulting in dramatic decreases in new HIV infections when implemented as a part of combination prevention strategy. And I would like to say that this is a boon for us and to the vulnerable key populations to prevent HIV. We need to capitalize on this invention. We'll include PrEP as a part of the combination prevention strategy here in Andhra Pradesh. I would like to thank the National AIDS Control Organization for releasing guidelines on PrEP, and this will guide us in promoting PrEP in the state. Firstly, our biggest focus should be on increasing awareness of PrEP as a prevention choice and helping the client to decide whether PrEP is right for them. This is a theme which we have embarked upon today, PrEP awareness and reach out in Andhra Pradesh. And this is apt. Only when we create awareness among the high-risk communities, there will be a demand for PrEP. BHS are already begun creating awareness on PrEP, but we need to implement the PrEP awareness program at a scale. I would like to emphasize engaging the community in the PrEP awareness and in the implementation of intervention. The community-led HIV prevention services, including PrEP, will help to reach out to people and who need the most. Again, for PrEP to be successful, adherence is critical and community are the best places to support in follow-up. Finally, I would like to assure that we will work towards addressing the social and legal barriers to HIV prevention services for the key and priority populations, as this impedes our progress towards achieving epidemic control. And in addressing the structural barriers, one of the landmark decisions that our government took and implemented is integrating transgender healthcare in the government health system. Thank you and my best wishes. Thank you all.
Thank you so much, ma'am. Now it's a memento distribution time. I request our Honorable Minister to give the mementos to the Dr. Sumayan Khan, DMNHO, Guntur. Madam. Congratulations, ma'am. And Dr. Cecilia, Principal, Guntur Government Nursing College, Guntur. Congratulations. Dr. Venkateswara, District 8